Hello everyone, this is Dr. Mahaboob Shahnawaz reporting to you from the Asian ENT Care Diagnostic Center located at Begumpet in Hyderabad. Welcome to viewers. Let's discuss today about a very intriguing topic called tinnitus. Tinnitus is a malady of millions, but no serviceable remedy has been found over the passage of years, whether it is India or abroad. So many people suffer from tinnitus and the agony is of millions, as I told. 0.8 billion people suffer from tinnitus and there are already 4 million Google hits available where people are frantically looking for tinnitus solution. We at ENT Care Center in Hyderabad, Begumpet have devised a new technology called Tinnitus Station, which assesses first of all the tinnitus of the patient. So prior to the assessment of tinnitus, the patient has to undergo all the other formalistical tests like the ENT opinion, the neurological opinion, the audiometric test, and other things. Once this data is obtained and the patient will be put on tinnitus station, a single hertz frequency audiometry which can start from 100 hertz and go up to 13,500 hertz in single hertz, and we pinpoint the exact point where the tinnitus occurs. So when this tinnitus is captured, we know that this is the thing that is triggering him. The causes of tinnitus are varied and many schools of thought have different opinions. So some think that hearing loss is a cause of tinnitus, some say it is a neurological condition. But 30 to 35% of the population don't have hearing loss but they still have tinnitus. So the cochlear module is represented tonotopically at the auditory cortex, and it is there that the phantom tinnitus is created and it gets imbibed into the patient's sense organs, and it is very devastating to have tinnitus because the head acts like a soundproof room. So once we have decided upon the tinnitus pitch of the patient and the intensity of the tinnitus, we have various treatment technologies. One of the treatment technologies is by giving medications for a certain period of time. Then we have what is known as cognitive behavior therapy. Then we have tinnitus retaining therapy where we give tinnitus retaining therapy for the patient, and then this is all done through a specialized device called Tinnitus Trio. Tinnitus Trio has 4 modules which has a tonal portion in it for treatment. It has got the musical portion called filtered music in its armenterum, and it has got the masking noise starting from 100 Hz to 13,500 Hz, and then it has also got the environmental sounds about 250, which will be used for desensitization. Musical therapy is used for relaxation, that helps the tinnitus patient a lot, not the ordinary music but the special filter music. Tinnitus Trio comes in a tablet or in an Android, any Android device like a mobile phone, and the audiologist and the clinician will give the cognitive behavior therapy, tinnitus retaining therapy, and a full range of activities concerned with the hearing and the auditory portion. And then these modules are put into the patient's tablet, or a dedicated tablet is given where the patient is instructed to carry on these activities for at least 8 to 10 months on a regular basis on a 5-day in a week for about 1 hour. So results have shown that there is a phase shift in tinnitus, and the patient who suffers from tinnitus is greatly benefited with this sort of things. So different tinnitus patients act differently. Not the same results are achieved by every tinnitus patient. The earlier the tinnitus sets in, the better are the results. So if you get tinnitus, come to our specialized centers at the Asian ENT Care, where we take care of all your aspects of tinnitus, starting from the ENT examination to the final phase of giving you the Tinnitus Trio apparatus in a tablet or in a mobile phone, and guiding you at every step and monitoring you as a follow-up for the duration of the treatment that is acquired. So with this information, if you have more queries, please contact Asian ENT Care at Begumpet, Hyderabad. Their telephone number is given on the screen. Please do visit us. Thank you so much for your consideration and your listening skills. Thank you.